Now, I would like to invite Dr. Bhushan Patwardhan, the chief guest of today's session, to kindly enlighten us with his keynote address. He's the former Vice Chairman, University Grants Commission, New Delhi, and Chairman, Indian Council of Social Science Research, New Delhi, National Research Professor, Ayush, member of several academic research and policy committees such as Niti Aayog.
Thank you, Shailiji. We can
Yes.
skip the introduction.
Okay.
Thank you.
Thank you, dear sir.
Running out of time, so
Yes,
I'll skip
thank
that.
you. Thank you, sir. Welcome,
First
sir.
of all, thank you, the Baha'i Academy, for this session on the occasion of International Youth Day. And thank you, Bharat. Thank you, Dr. Azadi, and everyone who are present here. I will be very, very brief, and I'll try to spare some time for maybe some time for question answer rather than I only talking about it, So I'll skip first slides because already a lot of has been talked about it. In the introduction, Dr. Bharat Bhushan talked about it, then Dr. Azadi talked about it, and we have also seen some of the videos related. So I'll skip first slides because already a lot of has been talked about it. In the introduction, Dr. Bharat Bhushan talked about it, then Dr. Azadi talked about it, and we have also seen some of the videos related to this. I'll just skip that entire thing about what is SDG and how youth can play a role, and the UN Decade of Action and everything, Quite frankly, when I have worked with UN organizations, I have worked with WHO as consultant for some time. Recently, I chaired a committee on social issues related to COVID-19 of the United Nations itself, and I've seen this. I'm following right from what WHO was talking about after Alma-Ata, health for all by 2000, and now we are in 2021. We don't see health anywhere near. We change just Millennium Development Goal to Sustainable Development Goals, and we changed our mandates from Rio to Paris. So all this has happened. So I feel, Bharat, many times, when I deal with these UN guys, they are very well articulated. They will come out with very nice infographics and very catchy words and keywords. But I feel like I am catching sand in my hand. So by the time I try to see or try to know or try to understand or try to pursue what they actually want to say, nothing is there in my hand. So a very impressive setup, but I'll focus this session very quickly on the health, because we are talking about food and we are connecting it with health and planetary health, human health and planetary health. So we are going even one way beyond that. So Dr. Azadi, irrespective of biomedical sciences progresses, and I have been working in the field of health for several years and have watched it closely, but still we have no solutions for many issues, and I agree with many points what Janaki ji was talking about so passionately, Miss, that's so true. There has been population increase, demographic transition we are witnessing. We are now witnessing from double burden to triple burden of the disease, and diet, lifestyle, socio-behavioral changes, as well as the health costs which are going out of hand even in rich countries, forget about us. So all this, while it is happening, as we talked about the definition of food systems, to know food system is a subset of health system, because ultimately we are talking about health. So what is health? Unfortunately, in our country at least, we are equating health with medicine. And we have started believing that by taking medicine, we'll get health. When health depends on four major pillars of health, they are called as determinants of health, and they are genetics, lifestyle, nutrition, and environment. Out of that, nutrition and environment and lifestyle, these three are in our own hand. We can decide whether to go on right path or wrong path. And especially the nutrition is completely in our hand, whether to take good nutrition or whether to take. So this is something which we are missing. And when any of one pillar of this health, genetics, nutrition, lifestyle, environment, any one of them gets weak, then you need a support system, and this support system is medical care. And we have started considering medical care as the main pillar of health. Health cannot be achieved by taking medicine. We have to work hard to gain health. It is an active process in which we have to participate actively. And while WHO definition is about a state of physical, mental, social well-being, and not just absence of disease or deformity, Dr. Azadi, in management, there is a principle of management that you can manage only what you can measure. And if you see the definition of health, the well-being itself is not defined. We can't measure well-being at all. Forget about physical, mental, social. Well-being itself is undefined. But absence of disease or deformity is measurable. So our entire focus, because of this definition, went on to the disease and absence of disease. So pathology became the major domain, pharmacology became the major driver, and physiology went down the drain. So this is what has happened. And reason for that, we started getting into the society, what I would like to call it as a medicalization of society. So as I said, that by creating market forces and curative practices dominance, we have created this kind of a problems in availability, accessibility, and affordability in the healthcare. And this has led to a situation wherein we are witnessing today triple burden on health. The first burden is communicable diseases which we carry, like malaria, dengue, tuberculosis, leprosy, all that. Many of them are resurging. The second burden is coming by way of non-communicable diseases, be it cancer, cardiovascular diseases, and diabetes and asthma. They're tremendously increasing. In fact, India is diabetes capital. This is not something which we should be proud of. And the third burden is coming due to the lifestyle and environmental changes. It could be accidents, or it could be several other things due to pollution. So agencies like NIS, CDC, US FDA are emphasizing now importance of improved nutrition, reducing calorie consumption, and increasing physical activity, barring junk foods, red meat, sodas, sugary drinks. And look at that, all of that we are importing. When aerated drinks, sodas, are getting unpopular or out of fashion in the Western world, you will see Bollywood hero carrying a small bottle of Coke in hand, and a village boy without any chappal, he carrying that bottle in the hand. These are criminal advertisements. The kind of the work which is going on at present in developing countries is really, really worrying. The markets are getting created for those products which are proven to be unhealthy, proven to be dangerous for our health, and which have been practically getting out in the Western society are being dumped on us. And GMOs are posing even newer health risks. And GMOs in the food industries are really, you need one full session. I'll be happy to talk to Baha'i Academy sometime later on this GMO business. So healthy, organic, and nutrition food we must focus on. I will ask, where are millets gone? Where are millets gone? We are talking about oats and some exotic things. What are we doing, Dr. Bharat, in our own country? Well, food, we must bring food and nutrition at the center stage. The basic principle in health or medicine is cause no harm. Let the food be our medicine. That's what Hippocrates or Charaka also talked about. And not make medicine as our food. Look on the screen, you'll see one prescription given to a 70-year-old lady who is facing a respiratory problem, which could be simply because of some flu. And the kind of medicines which are being dumped, countless medicines, and that lady is saying, I'm not even able to drink water or eat food. How can I eat so many medicines? We are forgetting the patient. We are forgetting the person behind all these symptoms, and the whole industrialization of the pharmaceutical sector is now coming in the nutraceutical sector, because nutra industry is gaining more popularization because it is easy to put nutraceuticals in market than putting medicines or drugs in the market, So supplementization of societies now we are witnessing. So our health actually now is our hand. Health is precious to be outsourced to the doctors. Please don't outsource our health to doctors. It should be in our hands. And people need simple ways to achieve health, prevent diseases. People need healthy diet, healthy lifestyle, mental peace and relaxation, and the new integrative approaches which will involve surgery and emergency measures from allopathy and holistic preventive aspects from Ayush is the need of the day. So today we are in the era of medical care. We need to transit to preventive care, and then we have to really go to healthcare, true healthcare, personalized medicine, public health, person health and wellness-centric integrative approach should be our dream. But what we are doing, modern lifestyle, our homes are converted into home theaters, and multiplex is in our living room today. You can imagine it has enhanced because of this COVID. Restaurant culture has displaced home kitchen. We have outsourced our kitchens to Swiggy and Zomato, and mobiles have added to the threat to health. Look at what young people are eating. Look at what young people are spending their time. Look at what young people are spending on screen time. So these are some of the major issues which we should be really concerned about. Just today, JAMA, one of the top journals, this is today's article appearing in JAMA, trends in consumption of ultra-processed foods among US youth aged 2 to 19 years, and they have reviewed 1999 to 2018. And what they say, estimated proportion of energy intake from consumption of ultra-processed foods has increased among youths in the US and has consistently comprised of majority of the total energy intake. Now imagine, if your majority of the energy intake will come from this ultra-processed food, where are we heading? We know, and there are several studies which have shown that the sodas and fast foods like McDonald's are responsible for increased obesity in the US, and we are inviting the same trouble. Are we talking about food or medicine? Traditional or modern? Family chats or mobile apps, nutrition or supplements, living rooms or home theaters, home kitchens or home delivery, consumerism or minimalism. Everybody now in the Western countries talking about minimalism, minimalistic lifestyle, illness or wellness. These are the questions I'm posing. We know that food, health, and microbes, they are interacting with each other. And in fact, in our own body, our human cells are in minority. Majority of cells in our body are not human cells, they are microbes, be it viruses or bacteria. So unless you try to live in symbiosis with them, in harmony, it is impossible to get into any kind of a solution. Nutrition, we want nutrition, not just GMOs or capsules, brought out of these kind. You cannot really convert the food into a capsule and just take some capsules as your food. It is not possible. It is not sustainable, And some of these books which you see on the screen are by Vandana Shiva. I have interacted with her extensively, and her new book, The Two Futures, Food, Health, and Humanity, you must read. I have given a forward to this book. And also, those who are interested should read this Great Health Scam, which is on the GMO, and also late lessons from early warning by the European Environmental Agency. I can give one full lecture based on these books, but not today. I would end by saying that we are undermining not only the planet, the environment, but also undermining the aspirations of youth. Youth don't want this. Youth really don't want this, but we are imposing on them by creating an environment by which they start thinking that, oh, this is cool, this is fashion. We must, as elders, our responsibility to recheck our own behaviors. And I remember the Silent Spring when Rachel Carlson talked about it in 1964. Nobody believed, they laughed at her. And I also remember now, by ending this quote from Panchatantra, by cutting trees and by creating mud of blood, if one aspires to get heaven, what could be the ways to go to hell? I would end my quote slides. I will not read, but these are the messages for today's International Youth Day. I feel that every day should be the Youth Day. Why only International Youth Day? These are the fancies, but every day and the youth's involvement in all this is unquestionable. We don't need UN to tell us, And youth, especially the Indian youth, are so innovative. We must guide them properly. We must show them the right path, and the way in which they are getting carried away through the pressures created by the industry and agents like Bollywood, we must do something to reverse that, and that can be done by really talking or walking the talk and not just by talking. So I would end my here by giving my sincere thanks to Baha'i Academy, and especially to Dr. Lesan Azadi, and also my good friend Bharat, and all of you, Saili, and all. I could see only one young voice all so far, and that was Saili. So I thought of mentioning Saili here. I enjoyed the interaction. I look forward for some questions later,
Thank you. Thank you so much, dear sir. This was such a absolutely wonderful experience for all of us to listen to you. And your presentation was really very much scientific based, and there was an amalgamation of data, facts, and examples. So thank you so much. This was a real wonderful treat for all of us. And you have really posed the challenges which are there in our day-to-day lives and how we can overcome.